name is Amina Ngambwa, and over the summer of 2019, I worked with Professor Kristen Dowdy in the Anthropology Department doing research that examines how Rochester, New York is impacted by the carceral system. Rochester is an area that is heavily saturated with correctional facilities. There are over 35 of them within a 90-mile radius of Rochester, over a dozen of which are state prisons. This is a map provided by the New York State Department of Corrections and Community Supervision, and I have sectioned off the portion of New York State in which we are located. Each of these dots represent different kinds of correctional facilities, and Rochester is in the middle of them all. This research asks us to consider the ways in which Rochester itself might be considered a prison town, given that we are surrounded by prisons and are deeply connected to the carceral system. The majority of this research is based on participant observation, which is at the heart of ethnographic research. Through participant observation, I was able to visit prison towns such as Auburn, New York, and view and partake in social interactions there. I also conducted more formal interviews with folks that live or have lived in prison towns in upstate New York, as well as with current Rochester residents that are directly related to incarcerated people. Based on this data, I was able to identify some suggestive findings and emergent themes that describe how Rochester is impacted by incarceration. First, relationships to the carceral system are highly racialized, gendered, and classed. A former resident of Dannemora, New York, home of the Clinton Maximum Security Prison, described, in different words, the ways in which racist ideologies were built into the town due to the presence of the prison. Because the town itself was very white, people of color seen in the town were assumed to be tied to incarcerated people inside the prison, thereby creating an us versus them relationship that existed on racial lines. One woman, a Latina whose husband was previously incarcerated at Clinton, echoed these comments, noting that when she went to the convenience store in Dannemora, people looked at her disapprovingly, knowing that she was, quote, one of them. The gendered aspect of the carceral system is also clear. Men are statistically more likely to be incarcerated than women in the United States, though the rate of women's incarceration has grown dramatically. In the focus groups that we conducted, all of the participants were women with at least one incarcerated male loved one. The gender division can also be clearly seen with the creation of categories such as that of the prison wife. Notably, there is no category for prison husband. Class, too, factors heavily into examining systems of incarceration and their impact. When doing research in Auburn, many residents describe the family and friends of incarcerated people as being a burden on the local economy because of their lower socioeconomic status. One man described them as being, quote, unemployed welfare recipients that fail to find work and do not contribute to the local economy. Through them, he says, welfare makes its way into Auburn. Of course, the intersections between race, class, and gender cannot be discounted, and they inform one's experiences with incarceration in meaningful ways. This figure demonstrates clearly the racial and gendered relationships that influence one's likelihood of being incarcerated, with Black men and Black women being the most likely. Next, we consider the kinds of challenges that are associated with having an incarcerated loved one. One of the biggest challenges is visitation and associated costs. Many of the facilities in which people are caged are over an hour away from Rochester, and access to transportation or the ability to pay for it is in many cases limited. Other costs include packages, phone calls, commissary money, and gas. When describing the costs associated with being the wife of an incarcerated man, one woman says she spends about $1,000 a month, $160 a month on a 35-pound package to her husband, and an additional $200 a week on gas, phone calls, and other visitation expenses. These financial barriers are built into the carceral system and are counterproductive to the rehabilitation that is supposed to take place. Additionally, women in particular face the brunt of arbitrary corrections rules that both vary inside and between facilities. Dress code policies are often applied unevenly, and women describe being sent away for wearing leggings, for wearing dangly earrings or V-necks, etc. Much of this is up to the discretion of the officers on shift at any given time. However, in light of the COVID-19 pandemic, one woman remarked to me that she would gladly put up with the arbitrary corrections rules if it meant that she could see her husband. As the virus makes its way into correctional facilities across the nation, people with incarcerated loved ones are more worried than ever. With inadequate access to hygiene products, personal protective equipment, and health care, incarcerated people are among the most vulnerable, especially in crowded conditions that make social distancing near impossible. Against the backdrop of this pandemic, it is clear how the stigma against incarcerated people renders this group of people, and by association their loved ones, permanently criminalized. Prior to the pandemic, these sentiments were expressed by people on both sides of the equation. In prison towns, visiting families are often deemed to be criminals themselves. One Auburn restaurant employee says that he dislikes visitation days because visitors stand outside of his store and block the door. Quote, "We don't want people to think that is our clientele," he told me, again identifying the racial othering that takes place in prison towns. Further, many women describe having trouble being honest about having incarcerated loved ones. One woman's husband has been incarcerated for 25 years, and only 2 years ago did she open up to her colleagues at work about her relationship. Another woman got creative with her story, saying that her husband was a teacher in Buffalo. He was teaching in the prison, and he was incarcerated in Buffalo, but at the time, this alteration of the truth seemed necessary in order to maintain respectability. These anecdotes are indicative of a broader social phenomenon that stigmatizes incarceration and those connected to it. So we started this research by asking, how is Rochester a prison town? And as you can see, Rochester is central to the web of upstate New York correctional facilities and is deeply entangled in these systems as well. People from surrounding prison towns live and work in Rochester, and people from Rochester are incarcerated in those towns. This means that, even though there are no prisons in Rochester, the tentacles of incarceration are woven into our city and greatly impact our community. Understanding the carceral logics at play in Rochester means really looking at what goes on in our communities, from the placement of the Monroe County Jail in the middle of the Rochester City School District to the presence of school resource officers in our schools. On the University of Rochester campus, we see it too. The suggestion that the campus would be better protected if its campus safety officers were armed is just one example. And so, even without a prison in our town, we are, indeed, a prison town. That being said, this research is in its early stages, and there is still plenty of data to be gathered. Some useful questions to ask in the future include the following. How do disciplinary measures in the Rochester City School District contribute to what is known as the school-to-prison pipeline? What kinds of support networks exist in Rochester for those that are connected to the carceral system? How does the University of Rochester and access to it contribute to the carceral equation of the city? And most recently, how does COVID-19 illuminate some of the failings of the carceral system as it exists currently? What do incarcerated people, their families, and their communities need to be healthy, find safety, and find healing? These are some of the references that I used in order to work on this project, and I'd like to give a special thanks to Professor Kristen Dowdy for her constant support and mentorship, and a huge thank you to all of our interlocutors for sharing their stories and experiences with us. Thank you.